Everybody, I'm Chairman Dr. Gareva. Sorry for the delay. We are talking about setting up the group practice, and I firmly believe that this is one of the way to go forward in our individual practices henceforth. If you are going to manage the fight against the NGOs and the corporate hospitals which are coming up, there is nothing less than joining hands which is going to make us survive in our practice. No financial disclosures. So basically you also know that eye specialist gets converted to capital I specialist due to the faith and godly image conferred by patients. They pay us, touch our feet, saying that you have given us eyesight. Then that eye specialist exerts and does efforts to excel individually, starts feeling that I must do better than anybody else, and then of course compromises his quality of life. Sometimes he may compromise with ethics and knowledge update because the patience which we used to have 30 years back probably is getting less and less now in the newer generation. Due to the fear of being overtaken by our fellow eye surgeons, we keep on buying high-cost machines, which remains grossly underutilized. You imagine in any private practice, the theatre doesn't run more than 3 to 4 hours a day. We are then treated as potential customers by corporate companies for their profit motive. Somebody takes a car, another goes for a bigger machine, and the third goes for the sky and a plane to travel. What happens is that we start feeling that yes, we are dying into a debt trap, and somebody advises us, look, your income is low, you are deep in debt, you have a bad credit, you must act immediately. And what BD advises is, okay, then take some more high interest credit card, go for another private bank, and they will give you at a cheaper rate. You will be surprised how much happy the banks are when they are extending the loan to us. Who loses? The individual eye surgeon due to limited access to high cost technology, because you can't have all the machines together in one practice every time. And a helpless patient, because from where you are going to recover the cost of your machines? It's going to be from the patients. So he has limited resources to pay, and you are trying to do a race of modernization. What is the solution? Maybe from capital I we go to B, from individual effort to cohesive efforts, for individual acclaim to a collective acclaim, and for individual brand to a cooperative brand. Only thing is, when you are joining together, if you practice what you preach, you do not need to preach. So from I, can we become we when you are going to practice? The advantage is it shares infrastructure and equipment cost, reduced cost of service to the patients, multiple facilities can be present under one roof, individual members can acquire new technology. We used to be proud in our initial days saying that we are not jack of all trades, but we are master of all trades. Then down the line we realized that one person cannot achieve excellence in all the subspecialties which the ophthalmology is now getting. And then obviously if you have a group practice, you have better quality of life. Ask your wives when you go home. So one type of group practice which you are all aware of is the contemporary surgeons and friends. They join together and share equal the investment as well as the profit and loss. There is a democracy in the decisions, but however you must respect each other because you have closed down your own practices. There is no individual practice, and this was initially started by Disha Eye Hospital near Calcutta with their additional branches now. So I am not going to detail because this is not my domain. Now what we started was, as surgeons will continue the regular practice, but will join hands for the specific activity like a laser center, or ultrasound clinic, or maybe for eye banking, or a common operation theatre facilities. This is a separate entity as a private company, but controlled by clinicians, and then there are additional facilities provided to the patient. This was started in '94 in the form of Prathamesh Laser Center at Sangli in Maharashtra. These were the people who were together. We established in '96, 27 eye surgeons participated. There was no vitreoretinal surgeon that time because they were a scarcity at that time, and it was a 45 lakhs project. In '96, for a small district like us, 45 lakhs was a huge amount. But then we contributed only 50,000 per person and then took a bank loan. We rented a neutral place and we purchased the best equipments available at that time. We had one industrialist to guide us. Everybody may not agree with me, but we are most of the times fools in business. So it's better that some businessman also guides us. Whether to listen to him or not is our problem, but at least we should be aware of what are the good business practices. So we purchased all the lasers and fundus camera and everything. Why we did it? Because we wanted to treat our own patients. Our benefit was we did not need any further investment in diagnostic equipments. We could concentrate on modernization of operation theatre equipments, and then after a period of nearly 16, 17 years of practice, I could at least take first holiday after we started this. And there was a reduced moral responsibility for seeing patient becoming blind. Those of my age realized that whenever there used to be a diabetic retinopathy with hemorrhages, we used to say that either you go to Shankara Nethralaya or you go to Ahmedabad. The finances, after 5 years when the loan was fully repaid, and those who had invested used to get at least 15 to 20% on their investment, the working partner, those who were actually doing the lasers, was earning about 40 to 60,000 per year, and mind well, it was on an investment of 50,000. The patient charges, that's also important, remained unchanged for years because there was no immediate need of increasing the charges, and we could give concession for non-affording people. Then of course we had a newer ambition, and then we decided to have an examer laser. Now this was established at a different location because all directors of our earlier company were not willing to start a new venture. Some said that LASIK is criminal for cornea and the patient, and some said that LASIK is one of the fantastic surgery which has ever been involved. So obviously with two different views, we had to take newer team. Here also we took a loan of 55 lakhs from the bank, and there were 20 eye surgeons which were the part of this group. Now after about 3 years down, we could have asked for 2 lakhs each. Now to establish a LASIK center, we just had invested 2 lakhs and the members contributed only 50,000 rupees. So we took a LASIK machine. Now here also the idea was that the individual surgeon will treat his own patient. One thing we observed was that there were no charges paid for referring the patient. And I was challenged in a conference by one of our senior person, the doctor, you cannot survive, but if you survive and repay your loan, I will come to your place, even if it's a smaller place, to see that you are doing well. And I will agree that Dr. Nagpal kept his word when we asked him to come after 7 years. One thing which was possible for us was a strict quality control and high level of rejection of cases, because we did not have economic pressure when you invest so much. That is always distributed amongst all the directors and members. So initially we had a reduced income, so we went on putting up some additional amount which was interest free, and then all latest equipments desirable for best results at that time were procured. Every member, we thought, would need to just bring one patient per month. That was my calculation when we started this. We required 7 years to become loan free. One of the reasons was there was no advertisement, there was no reference charges or cut practice. There was a competition with adjoining districts. When we asked the members to put in just about 50,000, somebody else advised them, why do you want to put 50,000 or 1 lakh? We are giving you membership free, and on the contrary we'll pay you extra. Lack of awareness in patients, because in that time, in around 96, 97, patients were not that much aware about the LASIK and the results. And even the ophthalmologist used to say that you do a LASIK and the patient is going to be half blind throughout his life. We needed really to convince the ophthalmologist also. Calculation of 1 case per patient. Mind well, it's almost 16 years we are running the company, and still that dream has not become practical, because out of the 20 people, still we find that many people don't even bring 1 patient per month. Because one of the reasons they say is that chair time required for young patients counseling is much more. And today's practice is more cataract oriented. So he says that rather than convincing the patient for LASIK, it's better for me to spend my time in convincing somebody else for cataract. A recurrent cost of gas refill sometimes is never mentioned, but it was astronomical. I remember one in the rainy season, we had some fogginess and operation theatre started having slight leak. We immediately stopped it, and within a week we realized that we required 7 lakh rupees to change the mirrors inside the Lexamer laser machine. Then we had another type of group practice, which was the third venture which we started later, about another 10 years later. There was one senior surgeon, of course that time I was being called as senior, and then other associates. I had a major share of investment and control, but others could develop their subspecialties. That means we now have a veterinary surgeon separately, a cornea one, a pediatric ophthalmologist, etc. Now this has less responsibility or burden, and maybe one of them can take over from me the practice when I intend to retire. This was called as Amaya Lasers. We started it at Miraz, which is in Sangli district. A second branch was started in Satara, which is also near Pune, and third was Khed, that is Ratnagiri in Maharashtra. Here we are 10 eye surgeons and again a one industrialist. All the diagnostic equipments and super specialty setup like IOL master, fundus camera, green laser, OCTs, YAG laser, everything including high-end vitrectomy, biome, etc. was purchased for this. Then there was an initial investment of 1 crore. The loan was of 45 lakhs and the contribution was between 1 lakh to 5 lakhs only. That means the director had put in about 5 lakhs and the members had put in about 1 lakhs. The major contribution was mine. Then we started expanding this on our own, and now we have, as I said, 3 branches. The next group practice, because in all these things, one thing was sorely lacking is for a newer surgeon to have an entire setup including OPD as well as indoor, so that if he doesn't want to invest so much, can we give him something better? So we said that those surgeons who already have a practice can continue their practice, and the newer surgeons can directly join this type of group practice. So this we decided to join hands for a new establishment and a well-developed eye hospital which contained all facilities and equipments. This was again a separate entity as a private company, but remember there is one difference in this corporate one, that this is controlled by clinicians, and then the additional facilities for the patients can be given. We have a brand name called as Atharva Netralaya, and we say that this is a corporate hospital with personal touch. That's our logo. We had 2 branches. We started last year only. 2 branches in the city of Pune. One is right at the heart of the city and one is slightly on the outskirts. So as I said, we call it as a corporate hospital with personal touch because this has been managed by eye surgeons themselves, and who better will understand the patients rather than we ourselves. This again has a neutral place. Individual members can have their own practice or they may have their consulting room at the same premises. We have all the state-of-the-art machinery. It's an investment of nearly 3 crores. Remember that initial investment required today for any good surgical practice for ophthalmology is around 50 lakhs for a new eye surgeon. The group has advised that one person can invest 1 lakh and utilize all the equipments worth 3 crores, including the best of OPD facilities and all the assistance which is required, and the promoters are putting in 5 lakhs each. Now there are some philanthropic foundations which also came forward and contributed in the form of equipments for this particular group, with only one rider, that those patients who are non-affording, you will not ask them to leave the premises, but will offer them the treatment at least at a subsidized rate, and which we have happily accepted. Now this is one good thing. You will realize that we have more than 50 eye surgeons. This was when the slide was prepared. Last week we had our general body meeting and we added another 9 surgeons. So now we are 59 eye surgeons strong in the city of Pune. The project is of 3 crores, but remember each and every 59 person has a sense of ownership for everybody. And we say that with ownership comes the responsibility and satisfaction. Additional branches are proposed depending on the demand of group of eye surgeons in that particular area. We don't want people to travel, like the patients don't want to travel from one suburb to the other. The doctors also don't want to travel. So this is ideal for individual practitioners who are unrealistic invested in large setup, and ideal for young generation who have learned the skills. Now you know that there are a lot of fellowships available A lot of centers of excellence are available. We acquire the skills, and unfortunately, because the equipments are not there, we tend to just not practice that. So adopt the concept of group practice, my dear fellows, and possibly we will probably come to an end where we can really go back to our noble profession in saying that we give best to our patients. At the same time, we really don't have to have that economic pressure over our heads. Thank you for your patience.